Welcome to this explainer. Today, we're taking a pretty visceral, kind of shocking journey through some of the absolute darkest and most bizarre chapters of medical history. We all tend to take modern medicine and its super rigorous safety standards completely for granted, right? We just assume that when we go to get help, the treatment is actually gonna, well, help us. But as you'll see, history shows us that the road to modern healing is paved with some truly terrifying anomalies. Procedures that were meant to cure, but instead, they caused unimaginable nightmares. So we're going to break these down by the extreme methods used, ranging from brutal historical surgeries to chemical mysteries and even some mind-bending modern biology. Let's dive in. Okay, picture this. You go to a medical professional because you're dealing with severe mental stress, and their proposed solution is to, quote, jam a common ice pick directly through your eye socket and sweep it blindly. I mean, no way, right? It sounds like something straight out of a horror movie. But back in 1936, a guy named Dr. Walter Freeman popularized an unimaginably violent neurological intervention that did exactly this. And looking at the actual steps of the transorbital lobotomy, it's just terrifyingly flawed. Dr. Freeman legitimately believed he could cure mental illness this way. Step 1 was literally inserting that common ice pick right through the patient's eye socket. Then they just blindly sweep the tool back and forth into the brain tissue. The whole goal here was to sever the connections in the patient's frontal lobes. Now here's the absolute kicker. This wasn't some rare back alley thing. It was widely practiced. It was the ultimate medical betrayal. The grim result of this falsely promised cure was that thousands of totally conscious patients ended up trading their complex, vibrant personalities for a permanent vegetative state. They were basically trapped within their own bodies for the rest of their lives. It's a really chilling reminder of how disastrous early neurology could be. All right, moving to our next category, the chemical catastrophe. So we're leaving the era of primitive surgeries and jumping into the 1990s, a modern, highly controlled emergency room. But what started as a typical ER visit rapidly deteriorated into this creeping, mysterious emergency. In 1994, Gloria Ramirez comes into a California hospital with advanced cancer. Just minutes later, the staff draws her blood, and they instantly notice something is really wrong. The blood has this weird oily sheen and smells heavily of ammonia. Almost instantly, the healthcare workers in the room start getting severely nauseous, having breathing issues, and experiencing intense muscle spasms. Now, scientists eventually pieced together this wild theory about a deadly chemical conversion that happened right inside her body. You see, Gloria had been using a totally common substance called DMSO for pain relief. But they suspect her advanced organ failure actually acted like a volatile chemistry lab, completely transforming that simple painkiller into DMSO4, which is a highly toxic gas. Her pain treatment literally created an invisible lethal weapon. And to put that into perspective, this hazardous gas was so immediate and so devastating that 23 people in that emergency room fell violently ill instantly. Just imagine the absolute chaos. You're in a sterile, life-saving environment, and suddenly the air itself becomes a toxic trap that is actively taking out the medical staff. The whole crisis escalated so rapidly. 5 of those medical professionals got so incredibly sick they had to be immediately hospitalized themselves. It got so bad they had to completely evacuate the ER and bring in a specialized hazmat team just to scrub the facility down. Tragically, the exposure was so severe that one healthcare worker actually required life-saving intubation. And remember, this was just from being in the same room and breathing the air during a routine blood draw. It's absolutely crazy and perfectly highlights the unseen chemical dangers that can just unexpectedly pop up, even in modern medicine. Shifting our focus now to a deadly mechanical cure, where we see what happens when the cure becomes the killer. Take a look at this tragic irony. Back in 1944, Thomas Midgley Jr. contracted polio, which left him completely paralyzed. To handle this, he invents what seems like a brilliant intended solution, this elaborate custom device made of ropes and pulleys so people could lift him in and out of bed. But the fatal result? Midgley actually became entangled in those ropes and was strangled to death by his own invention. The very device meant to give him his life back is literally what ended it. Okay, let's step into the criminal underworld now for fatal extreme plastic surgery. This sequence of events is straight out of a movie. In 1997, Amado Carrillo Fuentes was the most powerful drug lord in Mexico. He's desperate to evade the authorities, so he checks into a private hospital in Mexico City for radical plastic surgery and liposuction to completely change his face. But massive complications set in, and he dies right there on the operating table. And the tragedy doesn't even stop there. The aftermath was brutal. The two surgeons who performed the surgery were actually found murdered just months later. Talk about a catastrophic medical failure blending with true crime. Finally, we are pivoting away from the dark horrors of the past to a modern biological twist, reanimating dead cells. Okay, what we are about to explore sounds exactly like science fiction, but I promise you it's 100% real. Scientists have discovered a third state of existence using things called anthrobots. Basically, they take cells from a completely deceased organism, but instead of just dying off, those cells spontaneously reorganize themselves into entirely new functional life forms. It's wild. We are literally redefining what happens to human cellular biology after death. Check out what these anthrobots can actually do. First, they have independent mobility. They can move around entirely on their own. But even more amazingly, if you place them near damaged human tissue, they are capable of repairing it. We are literally looking at a near future where we use reanimated dead cells to heal the living. It is such a stunning, hopeful reversal from all those destructive historical procedures we just talked about. So as we wrap up this explainer, having gone from ice picks and toxic blood to literal reanimated healing cells, I really want to leave you with this one provocative question. Think about it. If dead cells can be reorganized and reanimated to heal the living, what exactly is the line between life and death anymore? How are these miraculous treatments going to forever change our fundamental understanding of mortality? It's definitely a lot to chew on. Thanks so much for joining me on this deep dive into the darkest, and maybe now the most miraculous chapters of medical history.